Hi, this is attorney David Gibbs with the National Center for Life and Liberty. Many preschools and summer daycare programs are beginning to open again in May and June across the nation, serving all of their families, not just the essential workers. Now, this reopening process requires that churches and ministries, anyone operating a preschool, carefully evaluate all of the precautions that need to be in place. Now, my friend, opening in May or June is not a problem, but I would recommend that the process be handled in a way that does not create any unnecessary liability for the church or for the ministry. We have some recommendations for your consideration. Number one, we're recommending that you do not allow parents to enter into the building. If you can manage things in the parking lot or drop-off zone, that is far safer for your program. Number two, drop-off should be with as little contact as possible, with children being dropped off from the vehicle and even some of the staff that are there to greet them wearing masks or even disposable gloves to send the signal that you are indeed acting very carefully for the sake of the children. Number three, you need to request from your families that grandparents or immunocompromised individuals not pick up the children. We don't want them to in any way be put at unnecessary risk. We're number four, recommending that you maintain 10 or fewer children in the classroom if at all possible. Number five, that you will ensure and work towards a higher level of sanitation. Now, we do know many of you have very clean facilities, but working to have extra sterile conditions is definitely in this COVID-19 time period highly advisable. Number six, we recommend that you check the temperatures of all your staff members and your children every morning and sending home anyone that is showing a fever. This temperature check is something that you can monitor. You don't need to keep records of it or create a health form, but you're monitoring before the program begins. Number seven, we're recommending that you send any children with temperatures home for a quarantine period. That can be determined by the organization, but many health experts would recommend as high as a 14-day quarantine. Number eight, we're recommending that you immediately send home any staff member or child who begins exhibiting what we call COVID-19 symptoms. That would be shortness of breath, difficulty breathing, fever, chills, repeated shaking with some form of chills and sore throat. That those symptoms should not be something that you allow into your building. We know that as we're moving forward, there's going to be more questions. Our legal team at the NCLL is committed to you, to your preschool, to your program. We can do individualized coaching sessions or review your daycare's procedures. If that's a help to you, reach out to our team at the NCLL.